Hey guys, welcome to Medifaction. Today we will learn about the anatomy of tongue. So the tongue is a muscular organ in the mouth of most vertebrates that manipulates food for mastication and is used in the act of swallowing. It has importance in the digestive system and is also a primary organ of taste in the gustatory system. So to learn more about tongue, let's start. In this video, I will be enumerating an introduction, parts of the tongue, that is the oral part, pharyngeal part, and also posterior most part. We will also discuss about the papillae of tongue, muscles of tongue, blood supply, lymphatic drainage, the nerve supply of tongue, histology, and also some important clinical anatomy. Let's begin. The tongue is a muscular organ situated in the floor of the mouth. It is associated with the functions of taste, speech, chewing, deglutition, and cleansing of mouth. Tongue comprises skeletal muscles which are voluntary. Now, let's discuss about the parts of the tongue. The tongue has a root, a tip, a body which has a curved upper surface or dorsum and an inferior surface. The dorsum of the tongue is divided into oral and pharyngeal part by a V-shaped known as sulcus terminalis. The inferior surface is confined to the oral part only. The root is attached to the styloid process right here. This is the styloid process. So the root is attached to the styloid process and soft palate above aspect and to the mandible and the hyoid bone below. This is the hyoid bone. Because of these attachments, we are not able to swallow the tongue itself. In between the mandible and hyoid bone, it is related to the geniohyoid and mylohyoid muscles. This is the geniohyoid muscle. So, the tip of the tongue forms the anterior free end, which at rest lies behind the upper incisor teeth. The dorsum of tongue is convex in all directions. It is divided into number 1, an oral part or anterior 2/3. This right here is the oral part. This is the dorsum and this is the tip of the tongue. So this is the anterior 2/3 of our tongue. The next part is the pharyngeal portion or posterior 1/3, and it is separated by a faint V-shaped groove known as the sulcus terminalis. The two limbs of the V meet at the median pit named the foramen cecum. They run laterally and forwards up to the palatoglossal arches. The foramen cecum represents the site from which the thyroid diverticulum grows down in the embryo. The oral and pharyngeal parts of the tongue differ in their development, topography, structure, and function. The third part is small posterior most part. So this was the root that I mentioned earlier. So as I told, this is the sulcus terminalis and this is the point where they meet, foramen cecum. These are the palatine tonsil. These are different papillae which we will be discussing later. This is the lateral glossoepiglottic fold. These are nothing but lymphoid follicles. This right here is known as the vallecula and this right here is the median glossoepiglottic fold. This here shows the inferior part of the tongue and these are deep lingual vein. This is the frenulum, which is the portion which attaches the tongue on the base. This is the orifice of submandibular duct or sublingual papilla. And this right here is the sublingual fold with openings of sublingual ducts. Oral part. The oral or papillary part of the tongue is placed on the floor of the mouth. Its margins are free and in contact with gums and teeth. Just in front of the palatoglossal arch, each margin shows 4 to 5 vertical folds, named the foliate papillae. The superior surface of the oral part shows a median furrow and is covered with papillae which make it rough. The inferior surface is covered with smooth muscle membrane, which shows a median fold called the frenulum linguae. On either side of the frenulum, there is a prominence produced by the deep lingual veins, which I showed on the previous slide. More laterally, there is a fold called the plica fimbriata that is directed forwards and medially towards the tip of the tongue. The pharyngeal part, right here. The pharyngeal or lymphoid part of the tongue lies behind the palatoglossal arches and the sulcus terminalis. Its posterior surface, sometimes called the base of the tongue, forms the anterior wall of the oropharynx. The mucous membrane has no papillae, but has many lymphoid follicles that collectively constitute the lingual tonsil. Mucous glands are also present. So, this is the root of the tongue. This is nothing but the hyoid bone. This is the mylohyoid muscle. This is the geniohyoid muscle. The third part, the posterior-most part. The posterior-most part of the tongue is connected to the epiglottis by 3 folds of mucous membrane. These are the median glossoepiglottic fold and the right and left lateral glossoepiglottic folds. On either side of the median fold, there is a depression called the vallicula. The lateral folds separate the vallicula from the piriform fossa. Now let's learn about the papillae of the tongue. These are projections of mucous membrane which give the anterior two-thirds of the tongue its characteristic roughness. These are of following 3 types. Number 1 is valate or circumvallate papillae. They are large in size, about 1 to 2 mm in diameter, and are approximately 12 in number. They are situated immediately in front of sulcus terminalis. Each papillae is a cylindrical projection surrounded by circular sulcus. The walls of papillae have taste buds. Number 2. The fungiform papillae. These are numerous near the tip and the margins of the tongue, but some of them are also scattered over the dorsum also. These are smaller than the circumvallate papillae but larger than the filiform papillae. Each papillae consists of narrow pedicle and a large rounded head. They are distinguished by their bright red color. So, this is the sulcus terminalis and this is the circumvallate papillae. This right here is the filiform papillae. The filiform papillae or conical papillae cover the presulcal area of the dorsum of the tongue and it gives it a characteristic velvety appearance. They are the smallest and most numerous in the lingual papillae. Each is pointed and covered with keratin. The apex is often split into filamentous process. Next, the foliate papillae. The foliate papillae are present at the lateral border just in front of the circumvallate papillae. They are leaf-shaped. These are the fungiform papillae. Now let's move on to the muscles of the tongue. A middle fibrous septum, this one right here. divides the tongue into right and left halves. Each half contains 4 intrinsic and 4 extrinsic muscles. First, let's look intrinsic muscles. The intrinsic muscles occupy the upper part of the tongue and are attached to the submucous fibrous layer and to the median fibrous septum. They alter the shape of the tongue. Number 1. Superior longitudinal muscle. It arises from the fibrous tissue deep to the mucous membrane on the dorsum of the tongue and the midline lingual septum. They pass longitudinally back from the tip of the tongue to its root posteriorly. It inserts into the overlying mucous membrane. The superior longitudinal muscles act to elevate the tip and sides of the tongue superiorly. This shapes the tongue dorsum into a concavity and it shortens the tongue also. Next muscle is inferior longitudinal. It originates from the fibrous tissue beneath the muscle membrane, stretching from tip of the tongue longitudinally back to the root of the tongue and the hyoid bone. They insert into the mucous membrane of the tongue dorsum. It lies between the genioglossus and the hyoglossus. The inferior longitudinal muscles act to curl the tip of the tongue inferiorly. This makes the dorsum of the tongue convex in shape and shortens the tongue also. Next is transverse muscle. Before speaking about the transverse muscle, this is the superior longitudinal muscle which I was talking about. And this right here is the inferior longitudinal muscle. Let's continue about the transverse muscle. It lies as a sheet on either side of the midline in a plane that is deep to the superior longitudinal muscles but superficial to the genioglossus. They run transversely from their origin at the fibrous lingual septum to insert into the submucous fibrous tissue at the lateral margin of the tongue. Contraction of the transverse muscle acts to narrow and increase the depth of the tongue. The fourth one is the vertical muscles, right here. It is found at the borders of the anterior part of the tongue. It makes the tongue broad. Now let's see about the extrinsic muscles. These are the genioglossus, right here, the hyoglossus, right here, the styloglossus, right here, and also the palatoglossus, right here. The extrinsic muscle connect the tongue to the mandible via genioglossus to the hyoid bone, through hyoglossus to the styloid process via styloglossus, and the palate via palatoglossus. Now let's learn about the arterial supply of the tongue. It is derived from the tortuous lingual artery, which is a branch of external carotid artery. This is the external carotid artery and this is the tortuous lingual artery leading to deep lingual artery. So the root of the tongue is also supplied by the tonsillar artery, which is a branch of facial artery and ascending pharyngeal branch of external carotid artery. Venous drainage. The arrangement of the veins of the tongue is variable. 2 venae committents accompany the lingual artery and 1 venae committent accompanies the hypoglossal nerve. The deep lingual vein is the largest and principal vein of the tongue. It is visible on the inferior surface of the tongue. It runs backwards and crosses the genioglossus and hyoglossus below the hypoglossal nerve. This is the hypoglossal nerve. This right here is the lingual vein. And this is the dorsal lingual artery, which is accompanied by veins of dorsum of tongue. These veins unite at the posterior border of the hyoglossus to form the lingual vein, which ends in the internal jugular vein, right here. Lymphatic drainage. The tip of the tongue drains bilaterally into the submental nodes. This is the submental nodes. The right and left half of the remaining part of the anterior two-thirds of the tongue drain unilaterally to the submandibular nodes. This is the submandibular nodes. A few central lymphatics drains bilaterally to the deep cervical nodes. This is the deep cervical nodes. The whole lymph finally drains into the jugulo-omohyoid nodes, which is right here. Before that, the posterior most part of the posterior one-third of the tongue drains bilaterally into the upper deep cervical lymph node, including the jugulodigastric node right here. And finally, as I told, these all drains into the jugulo-omohyoid nodes. These are known as the lymph nodes of the tongue. Nerve supply. Motor nerves. All the intrinsic and extrinsic muscles except the palatoglossus are supplied by the hypoglossal nerve. The palatoglossus is supplied by the cranial root of accessory nerve through the pharyngeal plexus. So, 7 out of 8 muscles are supplied by 12th nerve. Sensory nerves. The lingual nerve is the nerve of general sensation and the chorda tympani is the nerve of taste for the anterior two-thirds of the tongue except valate papillae. The glossopharyngeal nerve is the nerve for both general sensation and taste for the posterior one-third of the tongue, including the circumvallate papillae. The posterior most part of the tongue is supplied by the vagus nerve through the internal laryngeal branch. So here, both the general sensation and taste by internal laryngeal nerve, which is a branch of vagus nerve. Here, both general sensation and taste sensation is carried out by glossopharyngeal nerve. These are nothing but the circumvallate papillae. Here, general sensation by lingual and taste by chorda tympani. Here, as I told, 7 muscles of tongue is supplied by hypoglossal nerve. Only palatoglossus is supplied by the vago-accessory complex. Histology. Number 1. The bulk of the tongue is made up of striated muscles. Number 2. The mucous membrane consists of a layer of connective tissue called corium lined by stratified squamous epithelium. On the oral part of the dorsum, it is thin, forms papillae, and is adherent to the muscles. On the pharyngeal part of the dorsum, it is very rich in lymphoid follicles. On the inferior surface, it is thin and smooth. Numerous glands, both mucous and serous, lie deep to the mucous membrane. Number 3. Taste buds are most numerous on the sides of the circumvallate papillae and on the walls of the surrounding sulci. Taste buds are numerous of the foliate papillae and over the posterior one-third of the tongue and sparsely distributed on the fungiform papillae, the soft palate, the epiglottis, and the pharynx. There are no taste buds on the mid-dorsal region of the oral part of the tongue. So this is a simple histological illustration. These are ducts, this is lingual glands, this is the corium, this is the striated squamous epithelium, these are nerves, blood vessels, these are muscles, longitudinal, transverse and vertical, and this is again the corium, this is striated squamous epithelium, and these are the lingual papillae. Applied anatomy. Number 1. Carcinoma of the tongue is quite common. The affected side of the tongue is removed surgically. All the deep cervical lymph nodes are also removed, that is, block dissection of the neck because recurrence of malignant disease occurs in lymph nodes. Carcinoma of the posterior one-third of the tongue is more dangerous due to bilateral lymphatic spread. Number 2. Sorbitrate is taken sublingually for immediate relief from angina pectoris. It is absorbed fast because of rich blood supply of the tongue and by passing of portal circulation. Number 3. Genioglossus is called the safety muscle of the tongue because if it is paralyzed, the tongue will fall back on the oropharynx and also may block the air passage. During anesthesia, the tongue is pulled forward to clear the air passage. Genioglossus is the only muscle of the tongue which protrudes it forwards. This is the genioglossus. It is used for testing the integrity of hypoglossal nerve. If hypoglossal nerve of the right side is paralyzed, the tongue on protrusion will deviate to the right side. Normal left genioglossus will pull the base to left side and apex will get pushed to right side. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.